sir. I'm Ashley. I'm going to be your nurse today.
Good morning.
Good morning. How are you?
I'm good. How are you doing?
I'm doing well, thank you. So can you tell me what the date today is?
October 1st, 2020.
Perfect. And then can you tell me your full name and your birthday?
Roger J. Murdoch, 5/12/56.
All right. And then where are we today?
New Braunfels, Texas.
And do you know what year it is currently?
2020.
Perfect. All right. So I'm going to start by doing a quick physical assessment, and then we're going to do a balance and gait assessment, which basically is going to see how well you walk and if you have any troubles, okay?
Okay.
Okay, so the first thing I'm going to do is the whisper test to test your hearing. Okay, so what I'm going to do is whisper a couple of phrases in your left ear and then in your right ear, and just repeat back to me, okay?
Okay.
Okay.
Red brick.
Perfect.
Train track.
Perfect. Okay, so the next assessment I'm going to do is to assess your breathing. Do you feel like you're having any issues or congestion today?
No.
Okay, so just close your left nostril for me. Just cover your left nostril and then take a deep breath through your right, and do the same thing with the other side. Any troubles?
No.
No? Okay. So the next thing I'm going to do is just test your lymph nodes real quick. I'm going to palpate or touch your lymph nodes here, post-auricular, and then submandibular, and supraclavicular. Any pain or anything when I touch there?
No.
Okay. Next thing we're going to test is your extraocular movement. So just look at my pen and then follow the pen with your eyes. Don't move your head, okay?
Mm-hmm.
Perfect. Okay. I'm going to take a quick listen to your heart and then your lungs. So I'm going to do your heart first so you can just breathe normally. All right. Now I'm going to listen to your lungs. So take a deep breath and exhale. Again. All right, they sound clear. I'm going to listen from behind real quick. Same thing, but a little quicker. Last one. Excellent. All right. All lobes sound clear. Last thing I'm going to do before the balance assessment is muscular strength assessment. So first, I'm just going to do your head. So push up against my hand here and then back against my hand here. We'll do the same thing side to side. Right here. Now the other side. Perfect. And try to lift up your shoulders. Perfect. Okay, can you hold your arms up like this for me? And then push down against my hands, up against my hands. Same thing with your hands here. Here. Perfect. I'm going to do the same thing with your knees and your ankles, okay?
Mm-hmm.
So push up. There we go. And then can you push down? Perfect. Up. And then down. Good. All right. Excellent strength in all limbs. So now we'll go ahead and move on to the balance assessment.
Okay.
So you're already in a firm chair with no arms or anything, so that's perfect. So if you will just stand straight up for me. Okay, and then put your feet together and then back apart. Excellent. Now, if you will close your eyes and count to 10 for me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. You can open your eyes and just make a 360-degree turn. Just all the way around. Awesome. Okay. So I'm going to do the nudge test. So what that is, I'm going to just tap on your sternum 3 times just to see how your balance is against pressure, okay? 1, 2, 3. Excellent. Okay, and the last step, I'll just have you take 10 steps that way and then come back towards me. 2, 3, 4, 5, 6, 7, 8. That's fine, you ran out of space. Go ahead and come back. Excellent. Okay, very good. I don't see any issues with your balance, and your gait was fine. You didn't have any stumbling, and you don't use any walkers or assisted aids to get around normally?
No.
Okay. So the last thing I'm going to ask you about is the safety of your home. Do you have any issues with tripping hazards, rugs, extension cords, anything like that?
No.
Any small animals in the home?
No.
All right. What about grandkids?
I got a lot of those.
Okay, so one thing to be sure of is to make sure toys don't get left around, because of course that could be a tripping hazard. And also with the grandkids, you want to make sure that medications are put away safely if you have any. Where do you keep your medications?
In the kitchen, way up high.
All right, sounds good. And then as I've seen from your assessment of your home that you have adequate lighting as well, so that's definitely important to make sure. And that's about it. Do you have any questions for me?
No, I don't think so.
All right, well, thank you for participating in my assessment.
Thank you.